We are taking our viewers live now to Michael Gunner, the Chief Minister of the Northern Territory, providing a COVID update.
Positive cases. We are now calling all cases since yesterday the Darwin and Katherine Robinson River cluster number 2. It may be linked to cluster number 1 that had the 21-year-old source case. This is not established yet. There were 9 new positive cases of COVID-19 in the Northern Territory linked to cluster number 2 overnight. This brings the total number of cases for cluster number 2 to 11. All 9 new cases are close household contacts of cases number 1 and 2. The 2 cases I updated you on last night. I will now go through these 9 cases in age order. All of the new cases are Aboriginal Territorians. A 71-year-old man, a 65-year-old woman who has been admitted to Royal Darwin Hospital, a 62-year-old woman, a 40-year-old woman, a 38-year-old woman, a 22-year-old woman, a 16-year-old girl, 2 5-year-old girls, twins. I don't have vaccination status details yet. Bar the 65-year-old woman who is at Royal Darwin Hospital, all other cases are or are going to the Centre for National Resilience. This is obviously a serious escalation in the COVID-19 situation in the Northern Territory. A major contact tracing effort has been underway since the first case we reported yesterday. There are new exposure sites which I will run through in a moment, and there are currently 161 close contacts. I want to touch on 2 important exposure sites separately, so I'll run through the other exposure sites now. These are all close contact sites. So if you have been to these places at these times, you must immediately self-quarantine, call the COVID hotline, and we will organise a test. Captain Jack's Fish and Chips yesterday, 15 November, from 12 p.m. to 12:35 p.m. Again, close contact site. Worley Health Service main clinic yesterday, 15 November, from 10 a.m. to 11:45 a.m. Kirby's Pub, Katherine Hotel, Wednesday, 10 November, from 10 a.m. to 6 p.m. Again, I repeat, close contact sites. Kirby's Pub, Katherine Hotel, Friday, 12 November, from 12 p.m. to 4:30 p.m. 2 important exposure sites I want to run through now, and they are the Katherine Hospital and the McFarlane Primary School in Katherine. First, Katherine Hospital. The times and specific locations we are still working on. Please keep monitoring the coronavirus website as we will provide that information shortly. Please pay close attention. Second, McFarlane Primary School. I encourage parents whose kids normally attend McFarlane Primary School but because of the lockdown are not at school today to please get your kids tested today. That's a request. McFarlane Primary School will be open tomorrow in line with the lockdown rules. So that's kids of essential workers and kids of vulnerable families. However, all kids will need to be tested on arrival. I know this is a serious development. We are doing all that we can to make sure that you are safe. This is what we are doing. The Katherine lockdown is extended to 6 p.m. Monday, 22 November. That makes this a 7-day lockdown. We have sent extra vaccines to Katherine. We have surged people to the vaccination clinic at the old high school site. Last week, we started a door-to-door public housing vaccination effort in Katherine that continues this week. We've extended testing hours to 6:30 p.m. and set up a second lane at the testing clinic at the hospital and put in additional staff. A walk-in testing clinic is now open at the Katherine Community Centre on 2nd Street. A meeting has been held this morning with the 3 Aboriginal health providers in Katherine, Sunrise, Worley and Katherine West. They are with us coordinating mobile testing, mobile vaccination, contact tracing, welfare support and education on symptoms. This is a coordinated effort. We are all working together. We'll do everything we can together for the people of Katherine. All Territorians have a call to action. There will be a mask mandate for all Territorians until 6 p.m. Monday, 22 November. You must wear a mask whenever you leave the home. You are permitted to remove your mask if undertaking vigorous exercise. If clusters 1 and 2 are linked, there is a significant gap between the last case on November 4 and the first case of cluster 2 on November 13. There is a chance the virus has seeded and moved. I need all symptomatic Territorians to get tested. We want to see a testing response across the Territory. There will be daily wastewater testing in Alice Springs, Tennant Creek, Katherine and Darwin. I provide a warning today. A positive wastewater result in one of these locations may be enough to trigger a lockdown or lockout decision. These are tough times for Katherine. I thank you all for complying with last night's snap lockdown direction. This is the third time Katherine's had to be locked down. I feel for the people of Katherine and Katherine businesses. We do not want to have to lock you down. You've done everything we've asked and you've made sacrifices for every Territorian. We're doing everything we can today to test and trace. We will not stop working. I thank everyone in Katherine who is vaccinated. The vaccine rate for Katherine is about 75% second dose. Everyone who has got vaccinated has done their bit to protect themselves and their community and to protect the Katherine economy. Your next job is to convince any of your reluctant friends to get the vaccine. Vaccines save lives. The vaccine rate for Katherine overall and within vulnerable pockets is not at a level where we can consider lockout as an option. This is our challenge to the people of Katherine. This is how you can best help us, yourself, your loved ones and the community. We need to see a vaccine response in Katherine. We need to see a testing response in Katherine. I know you can do this. Not in theory, in fact. You have done this before. Let's smash this, Katherine. To Robinson River. Our rapid assessment team arrived last night and they are already hard at work. Their top two priorities being to offer the vaccine to anyone who needs it and test for new COVID cases. We have conducted about 20 priority tests in Robinson River that will soon leave for Darwin and we should have results in the morning. We have enough tests to test the whole of Robinson River community and all of Robinson River will be tested over the next 2 days. But we are under no illusions that the risk for Robinson River remains real and we have more testing to do today. I mentioned yesterday that Robinson River has a good vaccination rate. 87% first dose, 77% full vaccination. As per our rapid response plan, additional supplies of the vaccine have been offered to anyone who is eligible and yet to be first dosed and fully vaccinated. This measure can save lives. I'll update you on changes to the Robinson River vaccination rate as I have it. The lockdown in Robinson River is in effect and compliance has been excellent, thank you. The people of Robinson River and surrounding homelands have responded magnificently. Borroloola. We have no known links yet to Borroloola or a reason to lock Borroloola down. We have sent a vaccine team to Borroloola this morning. We have stepped up our testing efforts in Borroloola and are asking anyone symptomatic to come forward for testing. Everyone who was tested positive yesterday and overnight are Aboriginal Territorians. Some of our best vax rates are in our remote Aboriginal communities. There are some very low vax rates in some remote Aboriginal communities. Please, we still have time for people to be vaccinated before COVID becomes a reality in your community. As the Cho said yesterday, as I've said before, you only have two choices. Catch COVID vaxxed or catch COVID unvaxxed. Please, please get the vax. And a final thought. Our schools are open in Katherine for Year 12 students doing exams. Doing a study during a pandemic is a test in itself. During a lockdown is a tremendous display of character. No matter your results, I am proud of you. The Territory is proud of you. Studying during a pandemic, doing your exams during a lockdown. You have got this. We'll do everything we can. So all you need to do is focus on your study and focus on your exams. We've got your back.